Fertility experts like me are always looking for any factors that can improve the chance for pregnancy and lower the risk for miscarriage. The hope is that if we can identify those factors, maybe we can do something about them to improve the chance for getting pregnant and staying pregnant until delivery. Scientists just discovered one of those factors: high blood pressure. You need to hear about this, so stay tuned. About 7 to 8% of women in the United States who are of childbearing age have high blood pressure. Women who have high blood pressure before pregnancy are at increased risk for complications during pregnancy, such as preeclampsia, premature delivery, fetal growth restriction, fetal death, placental separation from the uterus, and cesarean delivery. A few years ago, a large study in China found that compared to women with normal blood pressure, women with high blood pressure had a 21% lower chance for getting pregnant each month they tried. For men with high blood pressure, their partners also had a 21% lower chance for pregnancy each month. If both partners had high blood pressure, they experienced a 27% lower chance for pregnancy. Now, researchers have found that high blood pressure also increases the risk for miscarriage. When your doctor measures your blood pressure, there are two numbers. The first number is called systolic blood pressure. This is when your heart contracts and pushes blood through your blood vessels. The second number is the diastolic pressure. This is the pressure in between heartbeats. From these two numbers, your doctor can calculate a third number, which is called mean arterial pressure, or MAP. This is the average pressure from the start of one beat to the start of the next one. The American Heart Association defines normal blood pressure as a systolic of less than 120 and a diastolic of less than 80. Stage 1 hypertension is when the systolic is 130 or higher and the diastolic is 80 or higher, and stage 2 hypertension is a systolic of 140 or higher and a diastolic of 90 or higher. This study found that a 10-point increase in your diastolic blood pressure, or mean arterial blood pressure, before you become pregnant was associated with an increase in the risk of miscarriage of about 17 to 18%. This was true for very early biochemical pregnancy losses as well as for later losses, which could be seen on ultrasound. One interesting point about this study: it came from a larger study that was looking at the impact of low-dose aspirin on miscarriage risk. When they analyzed the miscarriage risk from higher blood pressure, they could no longer identify an effective blood pressure in women who were taking low-dose aspirin. Unfortunately, the numbers weren't large enough to be able to prove that low-dose aspirin is an adequate treatment for blood pressure-induced miscarriage. Our Infertility TV bottom line is this: higher blood pressures make it more difficult to get pregnant and are associated with a higher risk for pregnancy loss. Although we are lacking studies to show whether treatment of high blood pressure is effective, high blood pressure also causes lots of other problems in and out of pregnancy. It seems very reasonable if you have stage 2 hypertension to get it treated. For stage 1, you should discuss it with your doctor. Infertility TV is your most trusted source for accurate information on infertility and miscarriage. If you are not a subscriber yet, hit the subscribe button right now. A new episode is released every week. Don't miss any episodes. You can also check us out on our website, ivf1.com, where you can become a patient.